get it.
All right. Hello, everybody. Shay Moraga from Shay's Warrior After Cancer. We are here tonight talking about lymphedema and lymphatic massage. We have two amazing guest speakers tonight. Leah Wiltgen. Thank you. I want to make sure I pronounce that correctly. And also Danielle
Meglio.
Thank you. Again, just want to make sure I pronounce those correctly. Leah is a licensed massage therapist with a specialty in manual lymph drainage. She is a longtime desert resident, private practice here in the desert for over 28 years. We're a wide range of health conditions. Danielle is an occupational therapy assistant certified in lymphedema therapy, rehab community class coordinator at Eisenhower Health Hospital. She's been in care for over 30 years in different healthcare settings. But Danielle's prime focus now is working with the cancer community, cancer patients in active cancer throughout survivorship, lymphedema, and reduced mobility function due to the side effects from cancer treatment. Shay's Warriors is a 501c3 nonprofit, and we are an all-volunteer board of directors, ambassadors in the community, and we love to collaborate and be able to bring an education and more resources to our cancer survivor community, which is why we have both Leah and Danielle with us tonight. Welcome.
Thank you.
Thank you for having us.
Thank you for being here. And so with us is Dr. Sonia Fang, board member and owner of a clinic in La Quinta, California. Hi, Sonia.
Hi, nice to be here. All right.
So talk about lymphedema and lymphatic drainage and massage, because I know, being a cancer survivor myself, that there's so much buzzwords about lymphedema. Somebody the other day asked me, do you wear a sleeve when you go on your planes? And I was like, no, actually I'm like, because I was actually talking about how I felt a little puffy in my arm. And that was the first thing that came to their mind as another survivor. Like, no, I think I might just be a little dehydrated. And, you know, I was getting puffy then. So I am so excited to hear more about lymphedema and lymphatic drainage, because there's a lot of also massage therapists out there that say, hey, I can do lymphatic drainage. And I know that is also there can be some complications with that. So I'll let you guys take it over.
Want to start?
No, you go ahead.
Well, I've had a private practice, massage therapy practice in the Valley for, like you said, just about 30 years. I instinctively moved towards lymphatic drainage because my clients were presenting with certain issues, whether it would be post-surgical, whether it be just sensitivity of the skin related to cancer, especially because then you've got the radiation sensitivity post-treatment. So I started looking into different instruction, and I found that the Vader Clinic was the premier academy. So I got my certification in that, and just it really changed my practice. It added so many more modalities and more things I could work with. Manual lymphatic is technically not a massage. It's a treatment of the skin. We use just our fingers. We use dry dry surfaces. We can use a little bit of powder if we become too sticky. What we do is we just want to move the skin. And so we'll come across the skin with maybe the weight of a nickel. And what we do is we just move the skin to help stimulate the initial lymphatic vessels to move. I guess I should back up a little bit. The lymphatic system is part of our the system that helps clean our body. It keeps all of our subcutaneous tissue clean. It picks up all the old bio waste, the old cell debris, the old proteins, and that's all in the sub-Q. And if you were to peel your skin back, you would see the very thin, it's almost like a spaghetti network of tubular system. And in there, the initial lymphatic vessels, it looks pretty much like a Q-tip with flaps. So it'll stand alone, and they're anchored to the subcutaneous tissue by microfilaments, so they don't move, but they're attached to the skin. And what happens is on each one of the IVLs or ILDs, there are little micro flaps that are one endothelial layer thick. And as we move naturally, our skin will move. They will move, and the flap will open. The suction from the deeper collector valves will pull in the old used fluid, the byproduct, take all the old dead stuff out, run it through the system, go through, get it cleaned through the lymph node stations. It ultimately ends up back in, or most of it ends up back in the heart to help maintain blood volume, where it picks up the oxygenated blood, picks up everything we need, goes through our AAA, and then gets filtered back out into our arterial system, and then diffused back into the subcutaneous. So it's a constant movement, but there's no pumping mechanism. So what we do as therapists, if there is an area where either there's a mechanical insufficiency due to surgery or injury, or if a particular area is just overwhelmed, we come in, we alleviate the area of the excess fluid and move it off somewhere else so the system can kind of gradually go back and start working again.
So since it doesn't have its own pump, it has to be moved either through the massage that Leah was talking about, or through exercise so that you are pumping by muscles, or through wearing compression garments. And then what happens is what we call the dirty fluid, the stuff that we're trying to get out of the system. We want you to stay really hydrated because it is filtered through your kidneys and out through your bladder. And so if you don't drink enough, you can get really sick. But they do say anywhere between 10 to 15% of what we're trying to eliminate from the dirty fluid can come out through the urine. And so if you're not hydrated enough the next day, you might feel like you have the flu, or you might feel like what patients would say, a little icky. And so with me, I work primarily at a hospital. And so we work with patients who have just been diagnosed with cancer, all different types. A large number are breast cancer patients. And we see them through new diagnostics, through radiation treatment, chemo treatment, and then pre and post surgery, and after surgeries, especially reconstruction. And where the compression garments come in is because if you even had one lymph node removed, you are no longer at a very efficient lymph system. It's not doing the job anymore that it's supposed to. So even if one lymph node is removed, a garment is needed, especially for flying, so that you can contain that lymph system and have it pumped. And the way they explain it is, in a car, we have an engine, and in the engine are cylinders that have pistons. So in our bodies, the lymph nodes are the pistons. And when we move or wear a garment, that is creating that pumping effect that helps keep the swelling from occurring. And one of the big problems is education, is when patients are going through and being diagnosed and having surgeries, having lymph node biopsies or removals, they need to be educated that they should be sent to a lymphatic therapist right away to have all this education, because what we see a lot of times are ladies who've been out there 20 years after post mastectomy, and they've got an arm that's 3 times the size of their regular arm, and it could have maybe been averted if they would have been in a sleeve, because they noticed the one thing that triggered their swelling was that second airplane ride, or they went up into elevation into the mountains and they came back down and their arm was swollen. And it's because they don't have the same amount of lymph nodes that can function and clean the body as they did before they had them removed.
Do is it just mastectomy, or is it if you have a lumpectomy and you have nodes removed?
It can
Can
be
the effect be either?
It can be either. And I've even had a patient who had a biopsy done. They didn't remove the lymph node completely, but they had a biopsy of the tissue around, and she even swelled because they weren't sure if it was a lymph node or if there was a massive tissue around the lymph node in her situation. But I've had patients have one lymph node removed and have had the worst lymphedema I've ever seen. And then I've had ladies who've had 16 to 26 lymph nodes removed and have hardly had any. So there's no rhyme or reason. There's nothing in a book that says, if you have this surgery and you have this many lymph nodes removed, you're going to get lymphedema or you're not. And it's not just with breast cancer. It can be seen even with female cancer. Sometimes our breast cancer patients later on in life may get female cancer. And so then they've got their deep inguinal nodes that are, and even like the lymph nodes around our sex organs that are removed. And then that creates swelling in the abdomen or the lower legs as well.
And that's what I was just going to ask, because
Right.
I know a lot of people think that lymph nodes are just near the breast. Can you, and it's good because we like authenticity here. Tell us where all those lymph nodes, I understand a lot of our lymph nodes are here and throughout the body, but I also just realized that like now around our sex organs, our thighs, like tell us more about that.
So you have primary pumpers. So primary pumpers are the largest lymph nodes, and they're kind of like the main ones. You have your inguinal lymph node that's in your pelvic region. You have under the underarms, which are axillary, and you also have them in your subclavian. And then you have smaller pathways that help in getting rid of the lymph fluid. And then you have superficial, which is what we are trying to address when we are massaging the skin. And then the deep, deep, deep lymph nodes usually are the ones that cannot be reached by us. Those are the ones that are way down deep, like the inguinal node, or if there's lymph nodes for those who have had colon cancer around the colon, those we cannot physically reach. Those would be something that would be reached by a biopsy or removal during surgery.
And in the lymph nodes, is there a fluid? Like what is that? What is that lymph node comprised of?
In each lymph node, we kind of refer to it as a biofilter. And what it does is as the old fluid or the dirty fluid moves through each lymph node in each station, naturally we're born with about 600 to 700 lymph nodes, with the primarily being in our terminal here and then in the inguinals. As it moves through, what doesn't belong in our system stays there. And once that fluid, and then a little bit of the fluid will get kicked out to our kidneys and be urinated out, but the rest will pass through each lymph node in each lymph node station, we call it. And if it doesn't belong, it'll get pulled in. Eventually, if a person exposed to, what's the airborne? I can't think of it. If they're exposed to toxins, the body's going to filter it out. But if once a lymph node becomes full, it's no longer useful. It can't be replaced. It can't be, nothing. It just renders itself done.
So the protein, so that everyone can kind of understand, because sometimes we can get a little technical when we're talking. So I always like to make sure that we do layman's terms, is the equivalent of what you would consider white sticky milk. So the lymph fluid looks like white sticky milk, and it's protein rich, and it has all the bacteria, the cells that die off in our system, red or white blood cells. And the way I think of it is if I was on the LA freeway, the 10 freeway, and there's 300 cars in front of me, I'm not going anywhere until those 300 cars move. So when Leah was talking about the protein sitting in the lymph node, is if it doesn't drain itself or it can't get out and it's just sitting there, all those little cars on that freeway are getting backed up. And then what you see, or you may have heard someone say, oh, wow, I ended up with swelling in my arm and I ended up with a cellulitis infection. The reason why is it's kind of like when you see a pond that has no moving water, moss grows, right? So the same thing in our lymph system. If it's not moving, it's not being cleaned out or channeled out, what happens is it backs up, and then whatever's sitting there can kind of be like the moss in a pond, and then it gets kind of infected, and we end up seeing patients who have cellulitis infections, and then that has to be treated with antibiotics per their physician's orders.
And tell us what a cellulitis infection is for those who wouldn't know what that is.
So some of the things that you want to watch out for so that you would be able to identify is if the limb, whether it be an arm, or I've even had a patient who's had cellulitis in their breast, is if the tissue is hot to the touch, and not hot like you went outside and you got flushed and warm. We're talking if I were to touch my left breast and it was really, really hot, and I touched my right breast and it was just a normal skin temperature. You might see redness or pinkness. I've had some patients have rashes, open wounds. I've had a patient had a paper cut. I've had another patient who had an ant bite and ended up getting a streak of redness or even a red circular circle around the site. And then what you want to do is you want to catch it as soon as possible, because if it isn't caught, it can continue to swell and then the fluid can be passed on. And we've had some patients become what's called septic.
Wow.
Sorry, my mic was muted. So I think one of the differentiations between a cellulitis and, say, any other rash or eczema or something like that is the rapidity of it. So it is a very fast growing infection on your skin. And so sometimes it can grow by inches within 30 minutes. So that's when it's like, okay, you got to seek medical like help immediately. So it's not like, oh, I'll wait till tomorrow. No. You go right away, urgent care or emergency, because this is an emergent situation. Or else it could end up in a septic situation, and that's no bueno. No one wants to do that.
And it's very, very painful. You know something's wrong when someone has cellulitis. And like she said, it can come on with an ant bite. It can come on with a sunburn. It can come on with a paper bite and just balloon into something much worse.
And one of the main things you want to remember is if you are someone who is having manual lymph drainage or even a regular massage, is if you do end up having one of these infections, do not have any massage, do not use a garment, do not use a lymphatic pump. Some patients do have those pneumatic pumps, because what can happen is this, if it's not treated, that infection can be passed through the whole body. And so we always like to try and tell patients, if you think that you have it, please call your doctor. If your doctor's not available, because sometimes things happen after hours, is go to the emergency right away. Because like Dr. Fung said, you need to have this addressed. I've seen a patient have it grow several inches within 20 minutes of being in our treatment room. And I had to cancel and say, you need to go to the hospital right away. And at that point, it was so severe that they had to go on IV antibiotics. So sooner the better. It's better safe than sorry is what I tell my patients, or even, someone I know that's a friend and I see that, you need to go get that checked.
Mm-hmm.
Wow.
So some of the things that I will work with patients on for manual lymph drainage is it might be something as simple as they're coming in to see us for the first time to get education that they've never had. Maybe, what is this? What happens? What is lymphedema? What do we need to do for exercise? What is manual lymph drainage? How do I keep myself healthy? And then we talk about garments if it's appropriate. If it's someone who already has lymphedema, then what may happen then is we get a little more intense into MLD treatments, because now they have been diagnosed with MLD and it's no longer prevention. We would like to have patients at the time where we can get them for prevention versus trying to then handle them already having MLD. But if they come in and they've already been diagnosed with MLD, then it changes where our focus is still on the education, still on the exercise, making sure they're working with someone on good nutrition, staying hydrated. But then our focus goes into more massage, getting proper garments on, making sure that they're wearing garments that they can wear. That could be either a daytime sleeve, a nighttime sleeve, if it's someone who has had lymphedema in their arm. If they have lymphedema in their chest wall or abdomen, it could be a compression tank top. And then really getting them motivated. The research out there shows it is so important to have good nutrition, exercise, and stay hydrated. And what I'm seeing a lot of times, and we've all been guilty of this, we're humans, we tend to go for something other than water when we should really be drinking our water and keeping ourselves hydrated. Sugar and white flour really are not our friends. And especially when you're going through lymphedema issues, because it also causes such inflammation on top of the lymphedema. And then exercise. Sometimes, we're our couch potatoes, we're our worst enemies, but exercise is really important, and cardio. And even if it's just getting out and walking or getting into a swimming pool, if you've been cleared by your physician, because the water is hydrostatic pressure. And so when you're in there exercising, it's like someone having a full body massage, and it's like having a full compression garment on. And so some people go, well, how does that work? And I say, well, do you remember when you were a little kid and you were in the pool and then all of a sudden you got out and you had to go to the bathroom right away? Well, it's because all your lymph nodes were being massaged and we didn't know it at the time. We were just too young. Same thing happens as adults. And we'll see patients that come in and the water therapy is amazing. All of a sudden they come in, they're like, oh my gosh, I can take care of my lymphedema and wear my sleeve. I'm doing really well. You're right. But it's just getting us, we're humans, getting us into the habit of exercising, drinking our water, and eating good. Those are really important.
What would you say to someone who is experiencing lymphedema, they are overseeing you and they want to continue to work daily for exercise, something low impact? You did say cardio. Walking, we know, is probably the best form of cardio out there. But what about cycling? What about yoga? What about hiking? Sometimes that can be more strenuous. So does it have an effect also on the body if they're not staying fully hydrated?
So yes, if you're not staying fully hydrated, even for someone who doesn't have lymphedema, we can get sick, because especially during our lovely, wonderful heat out here, we tend to go hiking and bicycling and we're not prepared well. And so that's why I tell my patients, if you love to bicycle, if you love to go out and play golf, pickleball is a big thing right now, even swimming, you have to stay hydrated or you're going to end up getting sick. And then what happens is your kidneys cannot filtrate everything that's going on in your body, and it can make you even worse. I think any exercise is good. Walking is great because it gets them motivated. It's weight bearing. They're pumping the system, but some of our patients can't walk, whether it be their age or their arthritis. So then we say the pool, because the pool, you're 90 to 95% lighter. So for instance, if someone was 200 pounds, they'd be 90% less of their weight. They can get in there, they can do things they can't do on land. And so unfortunately, some of our patients we see can top to up to 500 pounds that have lymphedema, even if it's post breast cancer. Bicycling is great. Hiking is great. Some of the things that you need to be careful of is skin integrity with those. So you can't get any area that has lymphedema sunburned, because that can create some issues. It can create some issues for infection on the skin. The other thing is you don't want to cut yourself. So, if you're bicycling, even though you may have lymphedema, let's say in the arm from post-mastectomy, and I'm bicycling, I can scratch myself. I still can have other issues and get an infection on that cut, because my lymph system works with my immune system. It's like our, what we call layman's term, garbage disposal. And so it doesn't let us heal as quickly, or we may have other comorbidities that may cause problems. So I say any movement's fabulous. I love Tai Chi and I love yoga. I love those because they open up the system. They make you stretch. There's a lot of yoga moves that help drain the lymphatic system. So for instance, like I referred to before, we might see some of our breast cancer patients who end up getting ovarian cancer or cervical cancer. And there's several moves like Happy Baby, which I just love. There's legs up the wall. There's cat and cow. And some of you who don't know yoga, I'm sorry for all those references, but they help drain the lymphatic system. And how wonderful to be in a easy class that's welcoming, where you get to relax at the end. Because with the lymph system, that's another thing. Relaxation and mindfulness is very important, just as exercise. We don't want to stress ourselves out.
And plug there, we just had our Move to Heal yesterday, our partner with Eisenhower's Lucy Curci Cancer Center. And so I actually get to teach all of that as a certified oncology yoga teacher. So there we go.
So it's, I think the best thing is humans were made to move. And I've done an exercise lecture where the best reference is cavemen didn't pull up to McDonald's and get their food. Cavemen ran around and chased after their food, picked their berries. as humans, we've evolved. There's, get in the car and go, but actually we are made to move. We're not made to sit. And that's where a lot of our problems come in, even with lymphedema, because you can get treatment. You can have the best therapist in the world doing massage. And if we don't follow through, I always tell people it's a 50-50 deal. I do 50 with you, you do 50. And that's where we have to come together as a team. And if one falls down, then we got to come back and look at the situation again, whether it's through private, massage or through the hospital. That's what we really need to focus on, is being a team.
Yeah,
How long does a treatment take for lymphedema?
Generally, I can affect a change in an hour, depending on the situation. If there are clients that come to us post-surgical, whether it be cancer, ortho, vascular, the healing process at the incision site may produce some fibrosing or some scarring tissue. So depending on that, we may have to reroute, which is a really great thing with the pathways through the body. If there's a particular pathway through our axilla that is overwhelmed, or there's a mechanical insufficiency, we can then reroute that fluid and send it to the back and bring it up this way to another pathway. Generally, I take an hour because it can be a little overwhelming. Sometimes it's site specific. Sometimes we can do a whole body sequence. I've got several clients. I have a mom with 3 young boys. She loves the lymphedema treatment just because it settles down her sympathetic system. That's the other thing with MLD treatments. It helps the sympathetic and the parasympathetic. Our sympathetic is our fight or flight. Our parasympathetic is our heart beating every day. Our breathing is things that happen. We don't have to do it. So it allows those 2 systems to come down and kind of balance themselves so that the body can move on with healing itself. So generally we start out with an hour, site specific. So I'm dealing with a client now where actually there's 2 clients. I do a little deep tissue because of the fibrosing. The fibrosing will impede the movement of the drainage of the skin that we talked about. So you have to break that down. So sometimes we have to do scar revision or some deep tissue movement to break some of that up as per the patient's tolerance. So we can break that up, and then we can start squeezing it and kind of milking the tissue and feeling what the tissue starts to feel like. And then we can do some of that skin drainage, rerouting to the different pathways to work around it so that we can offload that affected area. It makes a big difference. And generally clients find a relief because we can see the movement of the skin. I always say, if you've got the swelling, especially with the lymphatic lymphedema patient, you've got that swelling. It's a tenseness of the skin. It's kind of like my analogy is the water balloon. When the water balloon is really full, it's really taut and there's a lot of tension. As we relieve the fluid, we move that fluid off somewhere else, that skin begins to move again. The skin will stretch, and that is very painful to most of the clients. So if we can alleviate some of that pressure under the skin, it allows them to feel better. It improves their range of motion, and they just feel better. And with the sympathetic coming down, they have that really, it's like a tranquil or a calming systemic effect. The other thing is, what? Oh, the other thing we look at too is with the exercise, we don't want our lymphedema patients to get their heart rate up, because the higher the heart rate, the more fluid that gets pumped through the AAA back into the system, the more it's going to be pumped out to our sub-Q. So the more fluid is going to be pushed out. So we really got to be mindful of that. And that's how we educate our clients. That helps with the garments. The garment is basically telling the body, like the pool, this is telling the body, hey, look, we got enough fluid here. We don't need any more. We can't take any more. So it helps regulate the amount of fluid that stays there, but it also helps with moving the fluid through. So it's pretty amazing what one treatment can do.
So my question is, before you talk more about the MLD, what is the difference between a traditional massage and MLD? Because most people don't know there's a difference.
I would say traditional massage is working the tissue. You get in, you can work very deeply. The lymphatic system sits on top. It's a very thin, pliable system. So we can push through to work in that deep tissue. and it's a traditional get in and knead the muscles, do some movement. I have some clients that the first time with manual lymphatics, like, what are you doing? You're not massaging me. But so the difference between the two is that we work the tissue with a massage, and in the manual lymphatic, we're working the skin, because that's what the system is attached to on top. So just the weight of a nickel across the skin can interrupt the drainage of the skin that's before it's picked up in the initial lymphatic vessels to be taken into the system, cleaned, and pushed through.
And I think too, some people get a little, you hear out there in the public, lymph and lymphedema massage is a hot little name out there right now. You're hearing it everywhere.
Beauty.
Dry brushing, use this marble stone. And the problem is a lot of people don't realize, yes, you can have a regular massage to help the lymph system, but it's not the same as if you had a medical lymphatic massage.
Correct.
So that's the difference. And then I always say with a massage, you're working deep tissue and muscles, whether it be light or heavy massage, and you're releasing the toxins, the acid from the muscle sometimes, where with lymphatic, we're releasing what's coming out through the lymph system. And that's why both massages we talk about, you need water for both, because you're getting rid of different things. And that's how I see the difference in how I talk to my patients about it.
Yeah. And bodies will react differently to each one. Some people come out of the massage, a traditional massage saying, oh my God, you hurt me. But in fact, we released all of the lactic acid, everything that's been stuck in that muscle. When a muscle's tight, it reduces the flow of everything. So we're releasing all that. So they think, oh, you hurt me in my massage. It's like, no, that's just everything we're cleaning out of your system. Your system's going, hey. So yeah, it does make a difference. Yeah. Is that clear?
Yeah, thank you.
Yeah.
There's so much to get out there.
There is, and you're right. It's such a buzzword right now, at so many different places. I also think within the survivorship community as well, the cancer survivorship community, that's like, well, didn't you go get a massage, or go get a massage? This will help. And some it's not always clear what type of massage to go get. And sometimes if you just want to go get a massage to just feel good for some self-care, but people are scared to get a massage because they think it might actually hurt the lymphatic system. So maybe you could tell us a little bit about that. If someone has had, let's just say they've had a mastectomy or a bilateral mastectomy on either side. Some of the buzz thing or the common knowledge is no, we shouldn't have blood drawn from that area. We shouldn't have me out here, Sonia. I'm lost for words right now. Yes, thank you. or even have that side massaged. Why is that? If you explain in layman's terms.
So basically, there are lymphatic precautions. So when I was talking about the education, some of the things that I wish that once someone, and again, breast cancer can be men or women now. I really want to make that statement. I have treated 7 men now with breast cancer, is education, how to take care of the skin, no cuts, no sunburns. If you're gardening, don't get scratched. And then the precautions are no blood. So no IVs, no giving blood, no blood test, no injections, and no blood pressure on the side that is involved. So if someone had a bilateral mastectomy, and let's say for education purposes, lymph nodes were only removed out of the right side, then the left side could be used for all of those things. The right side should never be used because let's say someone never gets lymphedema, but we don't want to induce the perfect storm to then create lymphedema. So I can give you an example. One of my ladies had bilateral mastectomies at the age of 35. And at 85, she lives alone. She passed out in her kitchen and someone was trying to get a hold of her, couldn't get a hold of her, went and checked, found out she passed out, called 911. She did not have a bracelet on the side that the lymph nodes were removed. So the paramedics just went to put the IV in on the arm that was closest to them. And what happened was when all was said and done and she got out of the hospital, she ended up getting lymphedema because that side was compromised and couldn't handle So what I usually say to patients, or even if it's a private client, if you've had lymph nodes removed, you should wear a medical alert bracelet or a necklace that states none of the above, no blood pressure, no injections, nothing on this side. And I talked to a paramedic. Paramedic said that they will look for a bracelet.
Yeah.
They will look for a necklace. Worst case scenario, maybe someone's purse, but if it's life and death, they're not going to look in a purse. And if something happens and they can't use the side that is supposed to be used, they will use that arm if it's in life and death purpose. But if it's not, then we want to make sure that we use the arm, educate patients to use the arm that does not have the compromise in it.
Does it matter how long post procedure, like how many years out or not?
It says in all the education, once you've had one or any amount of lymph nodes removed, you should never have those techniques or procedures done on that side.
Wow.
So you might hear a lot of people say, I had lymph nodes removed on both sides, or maybe they had cancer come back on the other side and lymph nodes were removed. You'll hear a lot of patients say, oh, they were taking my blood pressure on my thigh or on my leg, and that's why, or they did an IV in my foot for surgery because I can't have IVs in my arms. So that's why we really try to stress the education part.
Yeah, nothing to pierce the skin. The other really big contraindication is congestive heart failure. Because we're pushing fluid through the body, and this could come down from the most distal region in the foot, we're pushing all that fluid straight up back into the heart to help maintain blood volume. Congestive heart failure is a situation where the heart muscle cannot function at its proper capacity. So it's not good for us to push all of that fluid back to the heart that's already compromised. So we ask our patients a lot of really specific questions. Have you had a sunburn?
Mm-hmm.
I actually had a client who couldn't figure out, his doctor said, oh, you must have a leaking thyroid. And I went, well, that's new. What happened when he was 17 years old, he was out, Washington boy, he was throwing haystacks around. He got a really, really bad sunburn on his neck. So now he's got this kind of a donut around his neck here, and it's because of the sunburn. And lo and behold, I've been working with him for about 2 years. He went out, played golf, got another sunburn, and it just ballooned. And I looked at him, I said, did you ever get a really bad sunburn before? And he said, well, yeah. So, there's a lot of contraindications that we have to take, and a lot of times patients don't know what to tell us unless we ask them very specific questions, or it's like, well, I didn't think of that. So there's a lot of signs we have to look at with our patient, how they walk, how they look, how they talk, what is it about them? So there's a lot of consideration.
Had that patient had cancer or lymphedema?
Nope. Just a really, really bad sunburn. And it was funny. And I hadn't known that. And this is, he's now 75 years old, big husky guy. So he just got this, this like a donut around here. And he basically went out, played golf, got another really bad sunburn on his driver's side, on his arm while he was out playing, and it just poofed. And I looked and I went, aha, have you ever had a really bad sunburn before? Like it burned your skin. And he came up with that, and I said, that's lymphedema. That's why it's not a leaking thyroid.
But for lymphedema, it's not just post-cancer anymore.
Correct.
We're seeing patients after open heart surgery, after joint replacements,
Vasculars.
after vascular procedures. We've seen them also dermatology. We've had patients go in and have a spot burned, and all of a sudden has developed lymphedema from that. So it's not just from cancer anymore. There's other issues. And I think a lot of times it plays in what their comorbidities are as well. How healthy is the person? How are they eating? Are they being careful? It's Sun City out here. We have sunshine all the time. And a lot of times our patients, the biggest thing is they don't cover up. They don't use sunscreen. And so there's some educational tools in that as well.
In my practice, I see a lot of post-cosmetic surgery. So I see a lot of facelifts, breast augmentations, tummy tucks, where, even things that were done, let's say a year ago, I'm still seeing fluid in the abdomen, or I see seromas, or I see different things like full facelifts. I can work on them literally the day after surgery, post-surgery. So I have a letter that I send out to my doctors. I say, this is what I do. This is the benefit of this. I've seen patients in that particular field probably increase their healing time by at least 30 days. Because what we're doing is we're offloading all the old stuff, making room for the good fluid to come in, nourish the skin, and heal it. And it really makes a difference. And the quicker we get started on it, like Danny was saying, the quicker we get started, the less fibrosing is going to happen, the less of the hardening of the tissue in the other areas are going to happen, and we can clean it off. And it really makes a difference. And all it is that the ridges on our fingers moving the skin. That's it. And so with a lot of cosmetic patients, they already are at their most vulnerable point, like, oh my gosh, why did I do this? And I come in and I make them feel better, and they feel the relief of the tension of the skin. So, yeah.
So I think a big question a lot of people will ask, because I do a lot of lecturing out in the community, is what do I do if I need to be treated for MLD, or how do I get an appointment to get educated for prevention? So what I want to tell people is the first thing is you need to talk to your physician. It can be any physician. It can be your oncologist. It can be your primary. It can be a wellness physician, whoever you're comfortable speaking with. And so at my level at the hospital, I can't treat a patient unless we have a prescription. So the way that it goes is we get a prescription in from the physician, and it states what the issue may be. They come in, and then according to what insurance they have, we might be able to see them 1 to 3 times a week. And then our visits are an hour long. And in that time, we start off when we're first working with you, it might be education, some exercise, and then the beginning of MLD. And then as we work with you, your visits may decrease down to 2 times a week, 1 time a week, maybe once every 2 weeks. And in those sessions, what we talk about is we teach you how to do self-MLD, which is really important, because self-MLD, once you have lymphatic issues, you're always going to have it. It never goes away. It may be under control, it may be managed, but it never goes away. So we teach you how to do self-MLD, how to do an opening that you can do, opening all the lymphatic system before you exercise. We also talk about what exercise is the best. We make sure we get garments for you, and that can include a compression bra. It can include a sleeve. It could include a night sleeve. It could include a compression tank top. I also see head and neck patients who have cancer from HPV or from other issues. And so for them, we have to get them a head and neck garment for them to wear. So all of that is included. And then what we try to do is we don't just say, okay, we've had all your visits, goodbye. We try to titrate you out so you don't feel like you're just being dropped off the cliff, right? Because none of us wants to feel that way. And then luckily enough, if you are someone who has is a cancer survivor and thriving, or you're during treatment, Lucy Kersey does have exercise classes that you can take part in. And so what I like to do a lot of times is transition those patients into those exercise classes before they get done with our therapy. So I can keep an eye on them, and I can say, they can feel free to come up to me and say, you know, I know I saw you 3 months ago, but look, my arm is swollen. And I can say, are you doing this? Are you doing that? We do a little mini refresher in class, and then it doesn't work, then they can come back and get a new prescription. So that's how it works. We have a little tighter structure at the hospital. I think it's a little more free when you have your private business.
It's really great. And I always say, my friend Danny, she's got a lot more at her disposal with where she is and what she does. And I'm so blessed to have her as my friend and a colleague, because I do bounce a lot of things back on her. And we've seen sometimes similar patients, but it really helps to have that coordination with other therapists, because you learn so much. And if you have a question, you can go and ask. And it really does make a difference. And especially when you're educating people in the medical community about manual lymphatic drainage, it's relatively new, but it's been around for a long time. But a lot of people don't know about it, or it's out of their purview, and it's not in their practice, and they just don't understand it. So I see a lot of people say, well, I just had facial surgery, I can't have a massage. So I have to say, it's not a massage, it's treatment of the skin, very light. So there is a lot of education, and I call it homework for my clients. You know, I tell them, you know, get the dry brush, do the dry brush. It's going to stimulate the skin. So there's a lot that our patients can do to help themselves. And they pass it on with their other friends, because we always get phone calls, right? Just, oh, my friend saw you. This is what they said. I have a question. So it's like you said, it's about educating our community, knowing that they have these resources available to them, and that they can come to us and ask us the questions, and hopefully we can answer them, you know, so that they feel comfortable. And because we see them at a very vulnerable time, and we really appreciate that. We appreciate where they are.
So just to kind of give you a little understanding of what we meant by they don't understand what MLD is or what lymphatic issues are. I've been at the hospital now 26 years. And I've been doing lymphedema for 20. And it's just been the last 2.5 years that I have doctors actually putting in their notes, patient has lymphedema. Patient is being sent to the lymphatic clinic.
We'll acknowledge it.
Yeah, so it's really turned around. So fortunately for people maybe who are newly diagnosed or have never been diagnosed, there's physicians now that are recognizing it, which is a plus, so that you can get in and get treatment. And the other 2 things I wanted to mention is with everything we've talked about, skincare is a huge thing out here in the desert. So what happens is a lot of times we're out in the pool, we're out in the sun, and our skin gets really dry because we, go from sunshine to whatever our weather is or wind, and our skin gets really affected. Then if you don't keep it soft and supple, then we see cracks in the skin. And then if you have lymphedema, that's where a good opportunity for an infection. So one of the lotions that we use, and that is recommended by the Lymphatic Association and the National Lymphedema Association, is Eucerin. That is one of the only lotions that they will approve of, and our hospital will approve it for us to work with our clients, is because it absorbs, it doesn't have a lot of stuff in it that people are allergic to, and it's clean, and you can use it on broken skin as long as it's, just like a little crack, but if it's big, you don't, if it's a wound. And then the other thing is stress can create lymphedema. So stress can be good stress. Stress can be bad stress. So the examples are, I have a woman who has a very rare cancer in her elbow, and 1 out of 1,500 people can get this. So she was doing really well. Her lymphedema was under control, and all of a sudden her daughter got engaged. And so it was, Mom, come with me to the dress fitting. Mom, go here. Mom, go that. In and out of the car and doing all the things she was doing, her lymphedema flared up. Even though it was a wonderful event, she's helping her daughter get everything ready for her wedding, it was stressful. Now, the other stressful can be another medical diagnosis. So if cancer were to come back, or we have a lot of patients that get heart conditions, that's a medical stressor, and that can flare up the lymphedema. So 2 things that I like to use in my clinic when I work with my patients is, 1, mindfulness and relaxation. And I've even gone as far as to turn on my meditation music on my phone and put it in the room with my patient. And immediately within a couple minutes, they go from pain to just, there's like peace on their face and they can relax. And deep breathing, because we really need to work on diaphragmatic breathing from our bellies. Our lymph nodes, there's lymph nodes in the diaphragm. And when you start working on diaphragmatic breathing and deep belly breathing, all those little lymph channels in the belly start to work. And that's a great way to start. But also, if you watch someone that closes their eyes and they complete that kind of breathing, you can see them go from really stressed to just relax while they're on the treatment table before I even start. So those are 2 things that can be done at home just to kind of keep ourselves healthy.
Great.
Do you have anything else to add? We're about to kind of go into the last bit of our program and do some Q&A. And any other last bits?
I am so fortunate to have found the Botter Institute, and it has just broadened my ability to work with an entirely new set of clients. And I am so happy that I can bring them relief and explain it, because a lot of these people, when this happens to them, they're scared, they're afraid, they're thinking, oh my gosh, what's going to happen to me? So we're able to kind of educate them and make them feel better about it and let them know that there are alternatives. And that is very fulfilling to me as a therapist, and working with Danny as well. It's just,
And it's nice knowing Leah, because once a patient can finish treatment at the hospital, they're always looking for someone who can do something privately at home. And so then I can make that nice compliment, because we're trained in the same technique, Botter. And so that's really nice. And I think also too, just letting the patient know that there's help out there. No matter what their questions are, being able to reach out to somebody, even if they just want to find out information, that it's okay to reach out and then talk to your doctor about it. Don't be afraid to talk to them.
and we can talk to the doctor too. That's why I said, I always, if there's a client that comes to me, I send a letter out, as I did to you, Dr. Fung, and just lets them know what I'm doing. And it's like, I defer to the doctor. If there's something you would like to discuss with me, I'm more than happy to incorporate that in the treatment plan, or what would you like me to do? But I think it's just really important for the best outcome for the patient that everybody works together for them and puts them first and makes them feel good, makes them feel better about it.
And then one really last quick thing is a lot of people do not know that whether you're in the midst of radiation or at the end of your radiation treatment, or you've just had surgery, we can work with you during that time. Even if it's after breast reconstruction, we just have to follow certain guidelines. So it might be that we can work around the surgical area to get the lymph system going. And then within 3 or 4 weeks, when the doctor clears you, then we can work on the actual breast. Like if you have a trans flap where they make the breast out of your own tissue, then we're cleared to do that. So I just want to make sure people understand you can have treatment during radiation as long as your physician clears it.
Yeah. Communication.
Of course.
All right. Well, we do have some questions. I'm going to post them into the chat right now.
Mm-hmm.
It says, now Angela is a physical therapist. I have a few patients that are diagnosed with lymphedema in the lower legs. Does the treatment you offer help with lower extremity lymphedema?
Absolutely. Absolutely. The lower legs, obviously, is the further apart from the heart. It's the hardest, it's where everything goes down. It's got to make that U-turn and come up, whether it be circulation or otherwise. So absolutely, we start at the top. We open the terminus. We work the axilla. We work the abdominal area, because there's a big intake there, the diaphragmatic lymph nodes that she was speaking of. And we get the system percolating, and then we concentrate on the lower area, and we work the contraindicated limb first, and then we go to the more affected limb. We want to give the patient the best outcome. We want to get that system moving and percolating so that it can start regulating itself again. Sometimes it's just as simple as being overwhelmed, coming off a plane and that secondary lymphedema. Then you have that swelling. Sometimes it's a mechanical insufficiency, so we have to offload the fluid and move it somewhere else. But absolutely, we can generally affect a change in an hour. Mm-hmm. Sometimes it comes back quicker, but the more you work on it, the more homework you give them, the longer and the better the benefit is generally.
And with them, they'd also have the garments and exercise, and also something that we're seeing right now, and a lot of literature shows it with everything, is our weight. So the larger we are, the more pressure is put down. That's why you might see some patients who are 300 to 600 pounds that have the really bad swelling in their legs. They're more compromised because then the weight is pushing down on their lymph system. So with lower extremity, especially with every patient, but weight is a big factor on that.
Awesome. Thank
Sorry,
you.
my battery went low.
That's okay. Similar to that question on Instagram, we have someone asking, can you get lymphedema from weightlifting, just lifting? Like, I guess they're specifically asking about squats. They do they go to the gym on squats, and they don't use weights, but they're curious if they flare up lymphedema. They are not a cancer survivor.
So they'd first of all have to be diagnosed with lymphedema to have it flare up. So if there is an issue and they're thinking that maybe there's something going on, because some people can be diagnosed or born with primary lymphedema and not know they have it until all of a sudden they do something and it flares up. What some people need to realize is that when we're exercising, our tissue swells, our muscles get pumped. And so the swelling you might see is coming from that. So maybe talking to a physician to find out, is there really a situation? Or are you just getting a good pump and working on that Kardashian tush?
Yeah.
So
it can be someone just trying out of those squats, right?
Wish. Yeah.
So, if she's concerned or he's concerned, I would definitely talk to a physician if they're seeing this occurring, and then have something checked, because it may be something else. So, that I would talk to the physician.
Or there could be just some compression or overwhelmed. You got the superficial inguinals, and then you got the deeper inguinals, and certain pathways go into that. So sometimes, the muscles get big. They take up room. And so the bigger they get, the more they're going to push against circulatory system, lymphatic system, and your nervous system, and everything else that's there. You have to remember, the lymphatic system is a very delicate system, and it doesn't take much to inhibit it. So sometimes it could be as little as that. It's just being impinged. It's like sitting in a 90-90, 90 at the hip, 90 at the leg, and you have underwear on. It's gonna bother that. It's gonna stop the flow of the skin.
Awesome. Thank you. Also from Instagram, you talked about sugar, processed versus fruit. You said sugar wasn't your friend. It does not help lymphedema. Is there a difference between eating processed versus fruit? That's what they meant.
So I will try to explain, and Dr. Fung, you can step in. From the lymphatic world, what happens is, so we just had Easter, right, and Passover, and all those lovely chocolate bunnies and Peeps and all that wonderful stuff. That's processed sugar. And the more we take in, the more inflammation occurs. And then let's say if I'm someone who has diabetes, that's creating more of a problem. So processed sugar can create more problems, especially our patients who are diabetic, but also can create a lot of inflammatory problems and inflammatory response, and can add to the swelling and the weight that someone may be already dealing with. And of course, fruit is always better than a sugar, like a candy or something. And Dr. Fung, if you want to put in anything after that on medical part, that would be great.
Or I can add in too.
Yeah, absolutely. Yeah, well, so yes, I mean, sugar to sugar, although it's a little bit different. We're talking about fructose versus the glucose, right? However, not everything in moderation, and also, I mean, eating tons and tons and tons of fruit instead of, processed sugar, also not a great thing, also can create inflammation, and also blood sugar imbalance.
And I think we need to look at too, again, their comorbidities, my, diabetics, I don't want them having pineapple, watermelon, grapes are just little sugar bombs. I want them to have low glycemic fruits, anything that ends in berry. And then when you're talking about the processed sugar, nobody's just opening a box of processed sugar, right? It's what is everything else that's going along with it that's processed, which takes our body a lot of work to break down. And then we end up again with more inflammation. And we all know that everything that creates inflammation leads to problems. So anything that we can put into our bodies that doesn't make that worse, it gives us the best chance possible of fighting things that are not completely within our control.
And that's why I really stress, if they haven't seen a nutritionist, first to go to their doctor, because a lot of them can see a nutritionist through their insurance sometimes. But I always tell them it's very important. If you've never seen a nutritionist or a dietitian, you should really meet with them and make sure everything you're doing is correct. Because a lot of them are drinking like a Gatorade that's 4 servings, and they didn't realize, there's 30 grams per serving. So things like that maybe can be just education. So I really stress that they need to work with someone on their nutrition.
And we really want to stress that asking for a certified nutritionist or certified dietitian, not a health coach.
Yes,
there is a complete difference in that. Yeah, thank you. Awesome. We have another question from Angela. Can you treat patients after diagnosed with cellulitis?
Absolutely. I have a patient who had a cut, and that was about 23 years ago. And she suffered with cellulitis in her left leg for about 22 years now, I think. And she has, she's done everything right. She's gone, and her doctor up in Northern California told her it was leg edema. So, he didn't know. I mean, and so, that's what I mean. A lot of these doctors just kind of out of their purview. So she's got the pneumatic pump. She's got everything going for her. She watches her diet. There is a book on diet, on lymphedema diet. I should bring it out. But she's done everything right. Yes, absolutely. You can. As soon as the inflammation or the acute stage is passed, we can generally start working on it. We just don't want to push anything in the system.
So in the clinic, we have to go by guidelines. So usually what happens is if they get diagnosed with cellulitis, they have to be deemed cleared and on therapeutic level of antibiotics, which is 7 to 14 days before we can see them back in the clinic.
Right. And
that has to be deemed by their physician, their infectious disease specialist, whatever level that they're being treated at, before they can come back in and be seen for MLD wear their compression, and even use a pneumatic pump if they have one. So we really stress, please don't do any MLD or use a pump or a garment if you are in the stages of a cellulitis infection or regular infection until cleared and deemed by your physician to do so.
This client also, because her leg would swell fairly large and she was having trouble finding close fitting. So, I was doing the lymphedema on her, and I finally said, okay, we're going to get a little aggressive here. And I started doing some deeper work on her because she had a lot of the fibrosing. A lot of the underlying tissue was getting hard, and that was taking up space. So I started doing some of the scar revision work. We just started doing some deep work. We actually got her leg, and she was really good on her measurements. We got her leg to come down 3 inches. Because we broke up that fibrosing, we got rid of what was occluding the fluid drainage in the skin, and we were able to move it around. And she came down, and as far as I know, she's still doing really, really well. But she's a very compliant client, which we love.
Thank you. All right, Jason, a few more questions there. Jason asked, how do the compression wearables help one with? I know you kind of touched on this already, but we'll just reiterate.
So the first thing that I highly suggest is that you get proper compression garments, because what can happen is if you're not wearing proper compression garments, it can be more detrimental to you than beneficial. So anything, even some of our ladies who kind of fight us on getting compression garments, I will tell them, okay, if swelling's in the leg, let's go and get some compression exercise pants, because everybody loves to wear compression exercise pants, and put those on. And so we start at the lowest level until we get them down where we can get them a permanent garment. Because the other thing is, if you're not wearing the right garment, garments aren't always covered by insurance. And garments start at $67 and can go up as much as $400 to $1,000 a piece.
Yeah.
So if you had to go through 3 of those garments by the time your lymphedema was deemed under control and someone doesn't have it, that's a lot of money. So what we're doing is the garment is making a container around your tissue so the lymph system can pump up against it and maintain it and drain it versus it expanding. And so that's why you really need the proper garment, because if a garment isn't appropriate, it will just let the swelling occur rather than keeping it contained and drained.
It can also chafe the skin and thereby irritating the skin, creating an opening, which what's all you need is that micro opening for any kind of infection or bug to get in there, and then bam. I was going to say about something else about garment. But yeah, that's, and if it's not comfortable, a lot of my clients say, oh, I don't like it, I'm not going to wear it. And I said, we need to find something that you're going to like, that you're going to wear, how to get them in it, putting powder inside. So we show them all the tricks for getting into their garment. It's really helping them understand how to navigate it.
Is there a place locally or at the hospital where they are able to go, recommendation to try things on and figure that out?
So if you have an insurance that covers a garment, we have Serenity in the community, and Serenity will bill insurance. It is one of the few places that I know of, and Dory, who owns it, does do measurements. There are a few garments that she will send them back to us because we have more, knowledge with them because we use them on a daily basis. There is also another facility out here called
In and Out Mobility?
Yeah, they're called Home Mobility now. So they carry off the shelf.
With Molly.
So her name is Molly. And if you know that you need because there's different forms of compression. Let's say you're just using prevention. You need a 1520, which is the lowest mercury of compression for a garment. And your length and everything, you have no complications, you have no hanging tissue or anything, you can buy one there. And like I said, they're not inexpensive. If there is a staging where you have severe lymphedema and we need to work with you to get that leg down. So for instance, I had a lady come in with bilateral lymphedema and she had it in both legs, and we had to get proper garments on her. She wasn't wearing them. We got the proper garments, and in 1 week she dropped 72 centimeters of fluid. Wow. So you can imagine if she had to buy garments every time she went down. So we would like to see patients, get them to a managed level, get them in a garment, and then from that point, if they don't change, they can reorder on their own from either online or from our community vendors.
Awesome. Thank
And
you.
we're very fortunate. Both Serenity and not In-N-Out, what is
Home
it?
Mobility.
Home Mobility. They are really, really great about their practice. They're very, very helpful.
Great, thank you. One more question. It's kind of a question. I think I'm understanding this. Robin says, I was diagnosed with lymphedema on my chest and arm and side. I am in constant pain. I can't even be touched. It is so painful. I'm about 7 years out on the left side. Is there recommendations you would have if she is not local to the Coachella Valley? Who would she seek out to seek for help?
So some of the questions first of all, I would go back to the physician, whether if she had radiation, I would go back to the radiologist or oncologist and say, this is going on. If we have radiation, sometimes there can be nerves that are involved. It's like having neuropathy. If you have chemo, patients can get neuropathy from chemo. And so I would first find out what is causing that problem. I've had patients where even air touching them, they couldn't even handle that. So we have different techniques. We may work on other areas to drain first until we can touch the areas that are painful. But my first concern would be, why is she in so much pain? In a clinical setting, we can help with someone if it's, let's say, scar tissue from radiation and it's impinging a nerve, or it's from post reconstruction. So then we have in the clinic, we have ultrasound and we have other techniques that we can use. But my concern would be, why is the pain that severe still 7 years post? What's causing it? And then once it's diagnosed, then I would be referred to a lymphatic specialist and have them start working on desensitization, massage, things at the level she can tolerate until she can get things moving and pain can go down.
Yeah.
That was very nice.
So sweet.
Yeah.
Yeah. Yeah. And it's just the skin stretching, and the skin, when it stretches, is extremely painful. Like you said, even just air crossing it. So you just really feel for the patient. And that 7 years is a long time. I'm sorry you have to go through that.
Does private
Yeah.
accept insurance as well? Do you know?
I have really tried to work with insurances. I'm a self one person. I have applied to many, trying to help my clients, and I always get the runaround. They just don't want to deal with me. They just think, so, and I just feel so badly for my clients. And with Danny here, so I always say, where are you at with your insurance? Let's get you connected with Danny. At least you can go in there. She's got more at her disposal for treatments and things like that than I do. And that's what I say was great working tandem with her. She's fabulous.
Sometimes you might find a little private clinic that might take insurance where someone can have a little more leeway versus a big hospital setting. I'm reading her questions right here, and I think it sounds like she's got a lot of and I'm not diagnosing, some issues with nerves, and that's why, because I'm saying that because I've had patients with the same questions she's having. You really need to go back to the doctor and find out what's going on, especially since the question says that there was port debris left in on the other side. So no matter who it was, family, friend, or a patient coming back, I would say your first step is to go talk to the physician. Maybe they need to send you out to a specialist to really find out what's going on, and then see a lymphatic specialist.
Robin, we really hope that you are able to go back to your doctor as they suggested, and you get soon. Wow, look at that. There is a lot of questions behind lymphedema. Time flew. We're already like 8 minutes. This is amazing. I feel like we need to revisit this at some point down the road. And Leah and Danielle, you guys are a plethora of information and to our desert cancer community, our survivorship community, those that really are going through some of this pain. And thank you for all that you do for our community and helping us all heal. And Ross, thank you as well. It sounds like she's pretty happy. She's got some hair.
Hey, well, and reach out if you have any other questions, Robin. We're here to help you out with that, and thank you for giving Manual Lymphatic a platform that it's accessible, and you want to just make sure that you're dealing with with therapists who are trained properly. You don't want to deal with someone that did it a 20-minute course or a weekend course, because it's pretty involved. And, you know, I'm Botter trained, she's Botter trained. I feel that's the best in, you know, that I've looked at personally. So you just want to make sure who you're dealing with, like you said, it's a professional. So,
And just one little last thing is, I think you have to be your own advocate, and please never feel like you can't ask that therapist, where were you trained? How long have you been doing it? And, you know, what techniques do you use? What garments do you use? Because it's upon you to be your own advocate and get the best treatment that you can. And it's okay to ask that question.
Yeah. And if they can't answer, then don't go.
Absolutely. And that's what Shay's Warriors is about, is making sure people have this platform to tell more of how we can heal in life after cancer.
Right.
Thank you, Leah. Thank you, Danielle. Jeannie,
Thank you.
for fun. Thank you for being a part of this organization and just helping us. With that, just Dr. Fung is going to put Leah and Danielle's information in the chat, so they will have, everyone will have that. They'll be able to contact you later on if need be. If you love what we do and you want to help us in our mission, donate, give, or partner with us at shayswarriors.org. We have June 8th through the 11th. We are sending 30 cancer survivors to the I Am Hope Survivors Reset Retreat. That is done by our entire community, just by donations and events that we host in the Valley, and helping people have a platform to be able to share and heal after cancer. Thank you very much to everyone who's been a part of this. For information, go to shayswarriors.org. Check out the last two events before our June, and next week, or every week, we have Talk, Listen, Share right here at 6 o'clock Pacific time. My name is Shay Moraga. Thank you so much for being a part of this, and we'll see you next time. Bye.
Thank you.
Bye, guys.
Thank
Thank
you.
you.
Bye.